Warning: Aboriginal and Torres Strait Islander viewers are warned that the following program may contain images and voices of deceased persons. The following information and advice will assist you in preparing for your admission. The presentation will cover hospital journeys from pre-admission to discharge, details required to assist us in planning your admission, private and public patient information, providing feedback to WDHS, and privacy and confidentiality. As a patient of WDHS, you're entitled to high-quality services in a public hospital, and we aim to involve you in decisions about your care. The Australian Charter of Healthcare Rights promotes a partnership between you and health service staff and outlines your rights and responsibilities. Your hospital journey. Right person, right treatment, every time. You will be asked at all points of care to state your full name, date of birth, possibly your address and the procedure you're having. Your medical record also carries a unique number that the staff will check. The staff caring for you are taking these important steps to ensure that your care is the correct care for you every time. Pre-admission routine. You've discussed your problem with your surgeon and you have consented to your procedure. The pre-operative questionnaire must be completed and handed to admissions. It's vital that this questionnaire is completed accurately, including the medication section. Pre-admission appointments occur 1 to 4 weeks prior to your procedure date, and you'll be contacted with an appointment time. Depending on the nature of your procedure and medical history, you may have a telephone consult or a face-to-face appointment with the nurse. You may also need to see the anaesthetist, medical officer, dietitian, and physiotherapist. You'll be advised on how to access your surgery time at this appointment. Please bring all current prescription and non-prescription medications to your appointment. These appointments will take from a half to 4 hours. For more information about anaesthesia, visit www.asa.org.au. Please tell us if you have an advanced care plan, medical power of attorney, guardianship, or any authority we should be aware of. Tell the nurse if you have any allergies or special food requirements. Please tell the nurse if you have any issues that could potentially impact on your admission or discharge. Are you a carer for someone, or are your children solely dependent upon you? Do you need assistance or support when you arrive home? Do you have any disabilities, for example, hearing, vision, or memory loss? Theatre. On the day of your procedure, after presenting to admissions, you'll be directed to the pre-admission clinic and prepared for theatre by the nurse. After your procedure, you'll be nursed in theatre recovery until staff are satisfied with your progress. You will be moved to the day procedure unit or the surgical unit. For longer stay patients, please read the patient handbook provided to you upon admission, which includes 10 important tips related to pressure injuries, blood clots, chest infections, and suggested daily activities to assist your recovery. If you're feeling worse or your family are concerned that your condition is deteriorating, alert the nursing staff without delay. Be proactive and ask for attention. Discharge planning begins at pre-admission. A wide range of support services is available. Allied health services like physiotherapy and continence nursing, Francis Hewitt Community Centre services like Cancer Link Nursing and Men's Health Nursing. Should you require further assistance when you go home, with your permission, you may be referred to the Home Referral Service. The Patient Information Directory, located in your bedside drawer, includes the full range of available services. Follow-up appointments may be organised prior to discharge. You may be given a discharge medication script, which will need to be paid for upon collection. Cash, EFTPOS, ATM facilities are all available. Please ask questions about your medications to ensure understanding on discharge. Upon discharge, your written personal health management plan will be provided. Subacute services. At the completion of your acute hospital treatment, you may need further rehabilitation or restorative care and be transferred into our subacute program, where our specialist medical, nursing and allied health staff will develop individual goals with you on daily living skills in preparation for returning to home or transition into longer-term care. Discharge time is between 10 a.m. and 11 a.m. Remember to confirm your transport home with the discharge nurse. Private patient information. You may select the doctor of your choice from the visiting medical staff of the health service. You may be eligible for a single room. However, rooms are allocated on patients' clinical needs. You will be offered, dependent upon your length of stay, a choice of gift on admission. Daily newspaper, fruit platter, local telephone service, television service, and an extensive meals menu. The revenue and savings generated from the use of private health insurance enable the health service to maintain and improve services, as well as develop new initiatives. All accounts, including radiology and pathology, will be sent directly to you. You may have some out-of-pocket expenses, which should be discussed with your doctor and anaesthetist. Admissions staff can assist you with determining what your private health insurance will cover. Private uninsured patients should ask admissions staff, your surgeon and anaesthetist for information regarding any additional out-of-pocket expenses. Public patient information. You'll be treated by doctors nominated by the hospital. There is a fee payable for the television service. Radiology and pathology services will be covered by the hospital. What to bring for your hospital stay. Webster packs, all prescription, natural herbal or over-the-counter medications being taken or used. All mobility aids used, for example, walking stick and frame. Hearing aids, Medicare, pension cards and private health insurance details if applicable. Personal needs, sleepwear, underwear, day clothes, toiletries, glasses case. Writing materials, books, magazines, knitting or other such items. As a patient, you are responsible for your own belongings, and we ask that you leave jewellery or other valuables at home. Do you have any services like Meals on Wheels or Safety Link that need to be cancelled while you are an inpatient? If you've not already done so, please notify your nurse, who will be happy to assist you. Visiting hours. Visiting hours are flexible and as a guide up to 8 p.m, depending upon your clinical needs and the clinical needs of other patients. For our specialist areas such as midwifery, intensive care and subacute, there are some rest periods and visitor restrictions. Our nursing staff can advise you of the restrictions for specialist areas. We're able to cater for patients requiring special assistance. If you need an interpreter, are hearing or vision impaired, or have any other disability, please advise staff who will assist you. Who to talk to if you're anxious. Depending on the nature of your questions, either admission staff, the nurse or your doctor can assist you. 10 ways to be more involved in your healthcare. 1. Be actively involved in your own healthcare. 2. Speak up if you have any questions or concerns. 3. Learn more about your condition or treatments by asking your doctor or nurse and using other reliable sources of information. 4. List all of the medications you're taking. 5. Understand the medications you're taking. 6. Ask for the results of all tests or procedures. 7. Talk to your doctor or other healthcare professional about your care and treatment options while in hospital. 8. Make sure you understand what will happen if you need surgery or a procedure. 9. Make sure you, your doctor and your surgeon agree on exactly what will be done during the operation. 10. Before you leave hospital, ask your doctor or healthcare professionals to explain the treatment plan you'll use at home. How to provide comments or suggestions for improvement to the services we provide. You can. 1. Speak directly to a staff member or the department head. 2. Document your concerns on a patient consumer feedback form. 3. Ask to speak to the quality manager. Or 4. Write to the Chief Executive Officer, Western District Health Service. Or 5. Ask staff for further information that will assist you. Patient consumer feedback form. At WDHS, we strive for excellence in healthcare, putting people first. So your feedback is important to us to help us meet this goal. On admission, you'll be given a patient consumer feedback form to complete. Victorian Healthcare Experience Survey. Please consider participating in this survey. The results are a valuable quality improvement tool. If you do receive a survey, please respond. Everything you tell us is important to us. Privacy and confidentiality. Staff will only collect health information that's necessary for the service to perform its functions. Your privacy and confidentiality is respected by all staff at all times. WDHS is fully accredited against the National Safety and Quality Health Service standards. For more information on the Australian Commission on Safety and Quality in Healthcare, visit www.safetyandquality.gov.au. Thank you for listening to our presentation, which can be downloaded from the WDHS website on www.wdhs.net if you'd like to watch it in the comfort of your own home.